Handheld nebulizer, also known as a small volume nebulizer. First, the respiratory therapist must obtain and review the physician's orders. Next, the respiratory therapist will obtain any necessary equipment, such as the small volume nebulizer, sterile saline, a stethoscope, and should they need it, any monitoring devices such as a pulse oximetry. Next, the therapist will obtain the medication and dosage as appropriately prescribed by the physician. As you will notice, the respiratory therapist will knock to ensure privacy and ask for permission to enter. You must wash your hands or use alcohol-based hand rub for hand hygiene and then put on your gloves. As you notice, the respiratory therapist will communicate with the patient.
Yes.
My name is Maria. I am your respiratory therapist for today. May you please state your name and your date of birth?
Yes.
Thank you. I'm checking your wristband to make sure I have the correct patient.
As you noticed, as she approached the patient, she asked for permission to enter the room and greeted. Once the patient provided permission to enter the room, she introduced herself, let the patient know she was their respiratory therapist, and identified the patient using two patient identifiers. The first part of the two-part patient identifier is asking the patient to state their full name and date of birth. Once they have stated it, they will be compared to what is stated on the armband. This ensures the correct patient. Notice how the respiratory therapist continues to communicate with the patient.
Okay.
Okay, Mr. Sinclair. So what we are going to be doing today is we are going to be doing a small volume nebulizer. I'm going to be giving you a breathing treatment.
Okay.
Do you take any breathing treatments at home?
No.
Are you on any oxygen at home?
No.
Notice she explained the procedure and what she will be doing with the patient. She also did a brief interview by asking the patient if they use any medication or a home nebulizer at home. She even asked if they use oxygen at home. Next, the respiratory therapist will perform their assessment. This will be done by checking a pulse and comparing it to the monitor. She will assess breath sounds and respiratory rate. This will provide the respiratory therapist with a baseline to compare during the treatment and after the treatment. Let's watch.
Okay. So I'm going to listen to some breath sounds. I am going to look at your heart rate to make sure everything is appropriately before I set up your small volume nebulizer, okay?
Okay.
Okay. It's going to be a little cold, okay?
Notice she continues to communicate with the patient and politely takes their consent to perform. Assessing breath sounds will be assessing breath sounds, comparing the right lung and the left lung, and back and forth, all the way down through the lung fields, all the while assessing the respiratory rate as well to establish the baseline. Notice how she continues to communicate with the patient.
Okay, I'm going to go ahead and assemble your breathing treatment, okay, sir?
Okay.
She will use an alcohol-based hand rub or wash her hands prior to handling the small volume nebulizer. In this scenario, she is using a mask, but normally we would use a mouthpiece. She then will take out the nebulizer piece itself And last, she is taking out the oxygen tubing. She will untangle the oxygen tubing and connect it to the bottom of the nebulizer. Then she will take the other end of the oxygen tubing and connect it to the flowmeter. Remember, green means oxygen and yellow means air. Next, she will get her medication and accurately prepare the prescribed dosage and inject it into the nebulizer. In this scenario, she is attaching a mask, but normally you would attach a mouthpiece. She turns on the flow to the flow meter that meets the manufacturer's flow rate, which may be between 6 and 10 liters. Watch how she communicates with the patient.
I'm going to put this over your face, okay? I'm going to have you lift up your head just a little bit.
Okay.
Thank you. Okay. Now I'm going to...
Prior to providing the nebulizer with the patient, she looked for aerosol coming out. That's what the pause was between the flow meter and putting it onto the patient. Notice how she communicates the appropriate next steps with the patient.
I'm going to have you take a couple deep breaths. On every fifth breath, I want you to slowly take a deep breath and hold it for 10 seconds, okay? So on this breath, I want you to take a deep breath in, and we're going to count to 10. That way we can get the medication going all the way down to your lungs, okay?
Notice she explained why you must do a 10-second hold.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, slowly go ahead and breathe out. Good job. And we're going to let the medication run. Now every fifth breath, I want you to do the same motion, okay? Take a deep breath in, hold it for 10 seconds, and breathe out.
Notice the respiratory therapist continues to coach the patient on what needs to be done. During this time, she is also monitoring the patient and looking at the patient and their monitors. Please note that the patient's heart rate increases more than 30 beats per minute. The treatment should be stopped. Also note that if the patient's respiratory rate increases above 22 breaths per minute, the therapy should be stopped. It is important to continue to monitor your patient during the treatment. This is what she will be doing, including encouraging the patient to take a deep breath every 5 or 6 breaths until the treatment has been complete.
So I hear a little bit of sputtering in the medication. That means your treatment is almost done.
Sputtering is noted, which indicates therapy completion. Notice,
I'm going to take this off.
she removes the therapy from the patient prior to turning off the oxygen. If you also notice, the patient coughed and she encouraged the patient to cough. Should the patient not cough, encourage the patient to cough. Coughing is important and it should be encouraged. Notice how the therapist continues to communicate with the patient.
How are you feeling?
Asking the patient how they're feeling is important.
Okay.
Okay. So at this moment, I am going to listen to your breath sound. sounds again to see if the medication has worked properly, okay?
Okay.
Performing a post-assessment is important to identify the benefits of it. She will reassess breath sounds, respiratory, and the pulse of the patient, and will be noted during documentation. Please note how well the respiratory therapist communicates with the patient after her assessment.
Okay. So your heart rate was perfect, your respiratory rate is good. Is there anything I can do for you at this time?
No.
Okay.
Thank you.
I am going to rinse off your nebulizer so I can be ready for your next treatment, okay?
Thank you.
You're welcome.
Notice she disassembles the handheld nebulizer. All handheld nebulizers should be disassembled and rinsed with sterile water and air dried, or they may be discarded. If you notice, she takes off the masks, winds up the oxygen tubing again, and places it back into the plastic bag. If the mask or mouthpiece is soiled or any part of the nebulizer is soiled, it should be discarded and a new one should be given to the patient.
I'm going to get some saline, okay, so we can rinse it out for you.
Sterile saline should be used to rinse out the nebulizer. Once the sterile saline has rinsed the nebulizer and has been emptied out, the nebulizer should be placed for air drying. The therapist.
Sir, if there's anything else I can do for you, I will get out of your way. You have a wonderful day.
The therapist communicates with the patient, removes her gloves, and will wash her hands or use an alcohol-based hand rub to clean her hands. Next, she will document her findings during her assessment, before the treatment, during the treatment, and after the treatment. She will document, of course, her name, the date, and the time, the medication given, and anything else that is necessary to the documentation of the treatment for the patient. Once she has completed her documentation, she will move on to her next patient.